Hi, I'm Laura Circo and I'm going to do a central line flash today. Before that, I'm going to check the doctor's order, and going in, I'm going to introduce myself and verify the patient's name and date of birth and ask for any allergy, and also check the chart for allergies and explain the procedure. After that, I'm going to gather my supplies on a clean surface. Today we need 3 syringes, 10 cc's, and 3 alcohol swabs because the patient has 3 lumens. And if it will be a peripheral line, we're going to use 1 syringe, 5 cc's. After this, I am going to wash my hands. Check the site for any swelling, tenderness, redness, pain. If everything looks okay, then I'm gonna get ready my supplies. And unclamp the tubes that has no IV running, and the one that has IV running, I am gonna press the pause for the pump in case there is a pump, and I'm gonna select the injection site distal and pinch the tube distal to the injection site, and clean for 15 seconds. Let her air dry. Still there. Push into 3 mLs gently. If we feel any resistance, we need to stop and aspirate. Check for blood return. And notice the blood nature, if it's brisk or sluggish. And then inserting the normal saline using the push-pause method just to create turbulence. And in the meantime, watching the IV site for any swelling, leaking, and the patient's tolerance. Before I remove the syringe, I release the tube and release the pause button on the pump in case there is a pump. And put on a Kudos cap by hospital policy. We need to. We're going to do the same thing for the second line. Make sure that it's unclamped. With a gentle pressure, push into 3 mLs. And if we feel resistant, the same thing, we have to stop and aspirate and check for the blood return and for the blood natures, if it's brisk or sluggish, and continue to insert normal saline using the push and stop method. And in the meantime, watching the patient and the IV site, if it's any swelling or leaking. Clamp this before I remove them. Syringe, like this, and put a cure cap in case that policy is like that. And we're going to do the same thing for the third line, and make sure that this is clamped. And before I leave, I clean the area, and I'm gonna document how the IV site looked, the presence or the absence of the blood, the nature of the blood, and how the patient tolerated the procedure. And before I leave, I make sure that my patient is safe and comfortable.